to my yes. So my topic is components of a dissertation work, and I'll be discussing each part of it slowly. And if you have any questions, you can make a note and we'll have it in the end. So these are the main headings under which you write your dissertation in the end. So this is mainly going to be for the final years who are submitting the dissertation right now. And how do you start writing? Do you start writing with title, prepare the certificates, then go to introduction, then go to objectives? How do you start writing your dissertation? You usually start writing with the objectives in mind. First, everything is pointing towards the objectives. It is like the Garbhagudi of the temple. So where everything is pointing out towards the objectives. So we start with the objectives, then move on to the methodology. Then move on to the other aspects like results. Then you come to the review of literature. Once again, you've already worked on it. You have to refine it further, add more articles to the review of literature, and then go ahead. This is at the time of completion. Then go to discussion. Now you have results, you have review of literature. You are in a position to discuss it better. Go to the summary and conclusion. Then write the introduction, because that's the last part, and to be read, it is the first part. But while writing, you can go to the introduction aspect in the end, and then complete all the rest of the things. So this is how you proceed with writing your dissertation. Coming to the components, we know that the title and certificates are something very important. In our university, we have certificate which needs to be written by the student, saying that I have collected this data in this college during this period under the guidance of so and so. It's mainly saying that this data has been collected in an honest and with lot of research integrity and without any form of falsification, fraud, any of these. So this certificate is first signed. Once one certificate is signed by the student, then the other certificate signed by the guide, who will say that yes, this study has been conducted by my student under my guidance and all this data is authentic. Then comes the HOD signature. The HOD is now responsible for making sure that all the data that has been collected under the guidance of this particular faculty is again authentic. And finally, the head of the institution also signs. So your work is being signed by many people. So what you do has to be done in a very correct manner, following all the requirements of the ICMR guidelines and research integrity, because so many people are going to sign and say that this is an authentic work. Next is the copyright, which is also important, because copyright belongs to the institution you have collected data from. So you can't say the university has the right, the medical college has the right to project your thesis as a work by the student of their college and their university. So copyright, and at the same time, when you publish, you have to show this affiliation to your medical college or to your university when you publish. And recently I got a student who said कि my study was say a pregnancy in anemic patients and the outcomes of pregnancy, something like that. And now she wants to make a big change in the title, saying that I want to add something which is very attractive. I said, no change. You cannot change the name title of your dissertation, because this title is reflected in your scientific review board. It is reflected in your ethics committee approval letter. It is reflected in the exam section, where all the list of all the students and their dissertation titles have already gone there. So you can't change it now. If you have to, then you have to write to all of these and get approvals. Rather, you continue with the same old title, even if it is not too attractive. It need not be attractive. As long as it says what the study is and what is the study design, and clearly says what exactly you are going to do in the study, it is adequate. When you publish it, you can have more fancy terms and descriptions in your study. So keep the title as you have got in your EC approval letter, and the one that you have sent to the institution saying that this is my dissertation title. So this is about the titles and certificates. Coming to the next part, that is introduction. Always begin. See, we know that whatever subject you are studying, maybe OBG, ophthalmology, ENT, it's all science we are talking about. Bring in a little form of art by adding a nice anecdote or a saying by somebody which connects to your dissertation topic or the thesis topic. So then write a small introduction. The introduction, as I said, can be the last part of your work, okay? But the first part that reflects in your book, the final dissertation book. Suppose the study is on proptosis. You could start with what is proptosis? What is the significance of the problem? What are the causes? Why is it important to study this condition? All these in, say, 1 to 1.5 page introduction in a very simple and crisp manner. So introduction is the easiest to write, but it has to be simple, crisp, and should cover most of the aspects of the condition that you are talking. Next comes the objectives of the study. As Madam had just now said, the objectives have to be very, very specific. We call it, they should be SMART objectives. They should be very specific. They should be measurable. They should be achievable. They should be repeatable or reliable. And they should be time bound. So if you have already framed SMART objectives right in the beginning of your synopsis writing, you will not have a problem during your final dissertation submission. Suppose you haven't got them SMART. Say something was not really measurable, you had a vague term and terminology there. Now you will struggle to make it more measurable. You don't know how to measure it. I forgot to do that. That should not happen. So in the beginning itself, have your objectives in a very SMART manner. So you may have one objective, 2 or 3. Don't have too many objectives like a PhD study. So you could have something like outcome of pregnancy in anemic patients. Next, the maternal outcomes, fetal outcomes. You can define your objectives as per your research question and have them very specific. And mind you, these are the 3 points which are going to repeat in every slide because everything is pointing out to your objectives. So have your objectives as you have stated and in your synopsis and get them the same way in your final dissertation also. So you will not change the title, you will not change the objectives of your study in your final dissertation writing. The next thing is about review of literature, and the importance of it has already been told by Madam, but I'll re-emphasize here that review of literature is actually trying to say the thorough understanding that you have about that area of research you're talking about in your dissertation or thesis. Suppose it is, again, I'm giving the same example, anemia in pregnancy and the maternal and fetal outcomes. So your review of literature would start with pregnancy and in anemic patients or anemia in pregnant patients, the outcomes, what are the different studies which are saying. Everything would be covered in a very systematic manner. You can always start with some historical aspects. That will make it very interesting. Start with the historical aspects and then give all the basics. So since I am an ophthalmologist, say my topic is proptosis, I would start with basics of proptosis. What is proptosis? Why proptosis occurs? What are the different causes for proptosis? Then I would go to investigations. What are the different methods of investigations, evaluation of proptosis? What equipment is used? Suppose you are trying to use something new tool for your research tool, what we call it, say a questionnaire or a case record form, all that has to be presented in detail, how you are going to do it. And then finally, the methodology, how you have derived it. Okay, and then the management of the condition, proptosis, how it is managed, and in relation to the objectives of your study, include everything that is about proptosis in relation to the different causes, association studies, correlation studies, other studies which are relevant to your research topic and your objectives. So your review of literature mostly forms about 40 to 50% of your dissertation. So it's a big component of your final dissertation submission, and make sure you start this right in the beginning. Madam has already said, start with review of literature right in the beginning. Go on adding articles as and when you come with new articles in your IJO or whatever journals you are commonly referring to. Then comes the need for the study. Why do you want, we know everything, why do you want to do this study? Is there a gap in the understanding about this? Is there a gap in understanding about this condition in your area? Sometimes many things are known elsewhere abroad, but you want to know what happens in this area. So why do you want to do study? What is the need for this study should be included at the end of review of literature. Review of literature becomes very important because it strengthens your understanding about this topic. The next in the review of literature is how to do it. Okay, say you're talking about optic nerve. You write this: optic nerve is a second cranial nerve and subserves vision. You refer to one textbook and you get these lines and write it in your own words because you don't want to copy. You write it in your own words. Then you continue, you read multiple books, you get one more important information and you write here. It forms an important part of the visual pathway and connects the photoreceptors and so on, so on, so on, forth. Now, what does this "it" here refer to? It refers to optic nerve because you started with the description of optic nerve and you went on to another sentence saying it forms an optic. So this is giving a very clear meaning. Now you refer to one more book and you get one more piece of information and you want to add it. While adding this, you have to make sure you add it in a very responsible manner. Now you added some information here. It consists of Now this "it" refers to the optic nerve. It consists of axons and so on and so forth. Optic nerve head, you added one more line, consists of a central, and you separated these two by adding this segment. Now, what does this "it" refer to? It is completely changing the meaning of what you have written. So when you are referring to multiple resources, make sure you read the whole paragraph once again. Is it making sense? It's not making sense. That means now you either move this whole thing at the bottom of this second line or change this to once again optic nerve, so that finally the meaning that you are giving to the review of literature, to any part of your dissertation work, is useful and there's some sense in it. Okay, it is not just random collection of multiple sentences from different resources, but this is what you mean. Okay, so you have to make sure you read it 100 times again and again. Each time you're adding sentences, deleting something, make sure the continuity is maintained there. This is very important because recently one of my students wrote that he wanted to say this is macula and this is fovea in the center of it, while making all the paraphrasing because they're so scared of a plagiarism check. They want to write it in their own words. According to the new anatomy that he created, fovea was here, macula was here. So you can't change the anatomy, you can't change the facts. So make sure you read it, make sure that the meaning is not changed. Next, coming to methodology, remember whatever you have written in the synopsis, which use or a protocol or a proforma, whatever you call it in your institution, and you have got approval by the ethics committee, is all in future tense. You would have said that time ki I will be collecting patients from this hospital. I'll be including 100 pregnant women with anemia. I will be doing these tests. I'll be collecting 5 ml of blood. Now everything is done. Now your methodology has to switch to the past tense. So you have to say, I have done this study I have included so many people in this study. I have done these tests. So it should be all in the past tense. So it should start with the guidelines that you have followed. Very important, because all the research, any research that is done in human participants should follow the ICMR guidelines. So start with it, that this study was conducted in the Calicut Medical College, following the ICMR National Ethical Guidelines, everything in detail. Say that EC approval was taken and the protocol that was approved has been followed throughout. Okay, you have not deviated from the protocol that has been approved by the ethics committee. Say that every participant was included in the study after taking an informed consent, because this is an essential part of research ethics. So you have to include that in detail. How have you recruited? From where have you recruited? How many participants have you recruited? All these details will come. The participant characteristics. What is the inclusion criteria you have followed? What is the exclusion criteria you have followed? How many participants, and based on what sample size calculation you have included these participants? Write everything in detail, and now in the past tense. Give the operational definitions. So if you have defined anemia, if your study says anemia in pregnancy, what anemia are you talking about? Is it any hemoglobin level? Is it clinical anemia? Anyone having pallor you are including? Or are you defining by the level of hemoglobin? Or are you defining by the level of microscopy examination, saying that this is microcytic hypochromic anemia or megaloblastic? What kind of anemia are you talking about? All the operational definitions should be included in detail, without which you cannot go to the results, without which you cannot go to discussion. So these are very, very important aspects to be emphasized here. Next is the methodology. So give the whole methodology, how you have calculated whatever the hemoglobin level, or say proptosis measurement. How did you measure the proptosis? What equipment you used for measuring of the proptosis? Okay, how did you follow up a patient? Say the anemia and pregnancy and the outcome. How did you measure the outcome? How did you get the data of the weight of the child, baby, newborn baby? How did you do it? Who did it? Everything has to be written in detail, because this is what finally reflects in your publication also. It has to be written in detail. And what statistical analysis have you done? How did you store the data? What statistical tests you have done? All these things should be written in methodology in the past tense. So this section again becomes a very important section. And this is what will carry any mistake done here is going to be reflected in your results, in your discussion everywhere. So make sure there are no mistakes in this. Coming to the results. Always organize your results based on your objectives. Start with objective 1. What are the results for objective 1? Come to the objective 2. What are the results for objective 2 and objective 3? Categorize them and write them in that order so that there's no confusion, because you would have smartly made your objectives in a specific manner, follow the same pattern so you don't miss out anything, you don't duplicate anything, and there's no mistake in your flow of thoughts. So this is what is very important. Organize your results based on this. A few slides on how you can present your results. So now this is one study of my own student where she had done a study on tear film in certain circumstances, vitamin D. But here this is one table where it says females, males, and the total here. And this is a normal test and this is the abnormal test. This is the total. This is exactly how you can present your data in the tabular form. But tabular form is not very visually appealing, and therefore you often supplement it with a chart. These charts you can choose based on what is the data like. Here it is males and females, so I would prefer a bar chart. Okay, if you have only something that is within only one section of it show, you can use it in a pie chart form. So depending on how many groups you have and what data you have, you can choose your chart, choose your colors, and try to maintain the same colors throughout the presentation. So you have a chart here, table here, you have a graph here. So it gives a very good representation of your data. Always use even percentages wherever possible. Percentages will give a very good impact on, it improves the understanding of your data when you add the percentages. You can add the numbers and percentages to the graphs also, which was not there in this particular chart. Next is coming to describing the data. So your results have 3 components now. One is a text component, one is the table component, and one is a chart component. So table, we have understood how to put it. Chart also we have understood how to put it in the text format. Now, there are 2 ways of doing it. Present the data as it is, okay? So you say in this chart, you say that normal TBUT time was present in 48% of the females and 52% of males, whereas abnormal TBUT was present in 27.7% of females and 72.27% of males. Is it adding any value to what you are writing? You are simply rewriting the table and the same numbers here. So this is just like a presenting the data without putting any additional input there. So that should not be your approach. Your approach should be interpreting the data. So that is what you will be doing now. Now, what does this table show you here? You see that there are 36 participants in total. 25 had normal and 11 had abnormal test. Okay, so that could be something that you would like to highlight here in the same table. So you could start with saying majority, that is 69.4% of the participants had normal TBUT, and there was no statistical significant difference gender-wise. Because you have done a test, you can put the p-value here. You did not find any difference between the two. However, abnormal TBUT time was significantly more common in the males than in females, with a p-value of so much. Now, this is giving the whole meaning out, okay, rather than just presenting the data as it is in the table and in the chart. You are now interpreting the data, giving a meaning to it, and this will help you in the discussion aspect. If you write your results well, you are able to discuss well. So I hope you all are understood, and this has to be done for each and every component of your result for each of the objectives. So presenting data, you have to understand the terms that you use are very, very important. You often, PGs use association and correlation interchangeably. You cannot do that. Association is when, say, males and females, and good nutrition and poor nutrition. We are giving the data in the form of percentage, saying males, 50% of the males had good nutrition, 50 had poor nutrition, or whatever. So you have this cannot be correlation. You have to say association of gender with the level of nutrition. So it is more of association and describing the data in the form of proportions, okay, not incidence, not incidence or not prevalence. You have to say proportion because you have a small percentage of cases taken from the hospital. Similarly, if you want to say the weight, okay, you have numbers here. Here, this is all nominal data. Here, this is nominal data. This is ordinal data. Numbers are there. And you are presenting the data in the form of mean and standard deviation. Again, it doesn't become correlation. It is again association of weight. Whatever test you want to put, you can put. But it is again it becomes a part of association between the two things. Whereas this is one table, say number of hours of study by the postgraduate students and marks in the examination. You want to correlate. The more number of hours a student puts into reading, more marks he or she gets in the examination. Both are numbers. This also is a number. This also is a number. Here you are testing correlation. Here you use a chi-square test. Here you use a t-test because there are numericals mean values. You use a student t-test, use a chi-square test. Here you use a Pearson's test. So you please do not mix up association term. All these terminologies are very important. Use them correctly, appropriately. Okay. So make use of the right word at the right time and for the right test also. So this is how you present your data. When you use data, try to be very judicious with your use of colors, use of descriptions, use of because see here there is a transgender also in my student study. So don't use simple terms like male female ratio. No, there's one more gender there which is added. Be sensitive to that and add words, use words which take into account the presence of the third gender also. This is very important even at the time of publications. This is one more presentation, which is a correlation which I showed you just now. I have used the graph which has been prepared by the Excel sheet as it is, and now I use it. Now what is happening here? All the graph points, okay, are concentrated in one corner of this big graph. There's an empty space here, there's an empty space here, and all the points are crowded together. So I would like to present it in a more visually appealing manner, and therefore I changed the graph points, axis points. Instead of using 0 to 35, I make it 18 to 30, so that the graph is spread across the points are spread across the graph in a very clear manner. A person who is looking at your graphs is able to understand your graph better, rather than complicating it by putting them in a very one corner of your graph. So remember that you can modify the graph that is given by your Excel sheet. Don't depend completely on your statistician. You can do it yourself. You can do it. You can change the axis format and make the graph more visually appealing. So this is how you can present your data. Presentation of data can also be made in a very attractive manner. This was a study of proptosis by my PG, who presented the data using a graph, using a map of Karnataka. So this is a map of Karnataka, and this was during the COVID time that she had done this study on proptosis. She got a lot of mucormycosis cases coming from different parts of Karnataka. So she put this graph, which was very appealing, which clearly showed what is the geographical distribution of the cases she found. So this is Mangalore. Most of the cases came from Kerala, Karnataka, different places from Karnataka with numbers of how many cases. And also from Kerala, we also had a case from Calicut. It happens to be a coincidence. So this is a very good representation. Try to see beyond the graphs and given by and the statistical numbers given by your statistician. Do more than that. Try to think of it in a very different manner also. This is also another way of presenting your data. So usually you say, you put a bar graph and say 36% were neoplastic lesions, 22% were inflammatory, 36. You put a bar chart and just finish it. Why not use a pie chart and show it in more greater detail? So try to use your innovative ideas and say, what is it saying here? Neoplasms were 36%, and within the neoplasms, 22% were secondaries, primary malignancies were 6%, and benign masses were 10%. So it's giving additional information to just giving this particular information. So here also, infective, how many were bacterial, how many were fungal? As I said, most of these happened during the COVID time. We had a lot of mucormycosis. This was a significant increase in the number of fungal elements, which can be highlighted by using graphs in a very, very visually appealing manner. So try to think beyond what the statistician is giving you. Present your data in a very attractive manner. Also, when you use photograph, make sure you have taken consent for it. Mask, because this picture is actually showing the whole face. The photograph that she has is actually showing the whole face and he's identifiable. Now, with masking, showing only the eyes, for all those who are non-ophthalmologists, you black out the eyes if you want to show a lesion on the face. But for ophthalmologists, that is not possible. So we black out everything else, show only the eyes so that you can anonymize it as much as possible. Make sure you have taken consent while taking the photographs of patients, because privacy is something that is important. Tomorrow you're going to publish this. It's going to come to the website of your college, your university. It's going to be on internet because you have shared the PDF with somebody else. It's everywhere. The person should not feel bad that my photograph has been taken, it's published, and I don't even know about it. So this is very important to take consent during your data collection. In the results, when you are writing, you're typing very fast. Okay, you might make some mistakes. Unless you read it and go through it very well, you are going to miss it. Here, it's very important to see there are some reddish squiggly lines here, green, red. These are very easily indicating that there is some mistake there. Okay, the computer is helping you. Don't use a Word, Microsoft Word, like a typewriter. Use it like a computer. Okay, it will tell you there's a mistake here. There's a mistake here. Look at it. Try to check the mistakes and correct them before you send it to the guide. Don't let the guide sit and mark all your spelling mistakes and grammatical errors. Why are there 2 full stops here? There's no need for 2 full stops in any part of your study, in your descriptions. Make sure all these mistakes are corrected before the document goes to your guide. You don't want your guide to break her or his head in these small things. Okay, you want a guide to give you more how to analyze it, what are the limitations at a higher level and not at these levels. So make your document clean there. Use a uniform font, madam was telling just now. Here there is Times New Roman 12 font. Here suddenly changes to Calibri. Here suddenly the font goes to 14. Here the font becomes gray, and here the spacing becomes less. This is a very distracting kind of a document. Even if those red rectangles were not there, it's very distracting. It's not a good, it's not a neat document to correct for a guide. So when you present it to the guide, make sure all these are in place, and only then you go ahead with that. Coming to discussion. Discussion is the next step after you have all your results in hand. So you have, for each objective, you have 4 or 5 results, and in all you have some 9 to 15 to 20 result points. Okay, you need a discussion for each and every point. Now, point number 1, you gave this description of your proptosis cases. You are discussing it now. You're taking that part of the result and now you're discussing it. And you say COVID was present in 20, this mucormycosis was present in 26%. You're discussing that. Now what you have to do is, after presenting your first result, you compare it with other studies. Go to other studies which have discussed about the etiologies of proptosis, and there you might find something else. Okay, you might find some other numbers, some other conditions, and try to now compare how is this study different from this study. Is the result only different, or the participants are different? You may just suddenly find that your study was on adults, whereas this study was on children. And that's why there was a big difference in the way the causes or etiologies were found in this study. So now you compare and say that, however, this study was mainly on pediatric, and therefore the difference in the presentation could be because of the different populations under study. You study one more, which is again in adults now, but again, the results are quite different. Now you state why these results are different. Try to find out. Then you can say this study was conducted during the COVID times, where the mucormycosis cases had increased to a large extent, and therefore this explains why our study is different from this study. So try to bring in what are the differences in the studies that have already been published, and why. You have to tease your mind, you have to break your head over it. This is where your guide can help you. Where you are missing some points, your guide will be able to give you more points on why this could be because of her experience in the field. She will be able to give you, and that forms the discussion. So in discussion, you have the most important point of the result. Compare with studies which are similar studies with contrasting results or similar results, and try to find out what you conclude from this. Okay, that is very, very important in discussion. So each point in result has to be discussed in detail with use of as many references as possible for each one, minimum 3 to 4 for each of the points. That will give you a good discussion. Once your discussion is done, next you move to the, you have discussion for each one, and then you move to the conclusion. Next, you come to summary and conclusion. You know that you have 3 objectives, you have so many results, you have as many number of discussion points. Now you need to conclude, but your conclusions will be not for each of the points here, but they should respond to the research question and the objectives. Your objective was, say, outcome of pregnancies in anemia, outcome of pregnancy in anemic patients. You should say what was the conclusion of the first objective. What is the answer to the first objective? Conclusion number 2 would be what is your finding or your conclusion about the second objective and third objective. So they should be aligned. You cannot have more conclusions, something that was not your objective at all. Don't go on describing what is not there. Don't omit what is there just because you think that is not important. So everything now falls in place with results, discussion, and conclusion. And exactly the conclusions are in alignment with your objectives. Then summary. In summary is like an abstract of an article where you highlight all the headings, right from introduction, 1 or 2 lines, need for the study, review of literature, objectives, methodology, results, discussion, and conclusion. Everything put together. Somebody who really cannot go through the whole thing, can actually go through only the summary to understand what you have done. It has to be so clear. It has to cover most of the points in a very crisp manner. This is where your English writing skills can come into play. Then add the limitations of the study. You cannot always do a perfect study, right? You would have limitations. So for example, you started with anemia and pregnancy and tried to see the outcomes of pregnancy, but you found that many of the patients were getting referred somewhere else. You are following them up, but outcome you don't know. So you can say the limitation of the study, lot of dropouts were there. We were not able to follow up the patients till the outcome, and that was a big drawback for it. For another study, you might say you have OCT, a big instrument which has come new to the department. You want to do a study on that. You have included for the dissertation. And after 4 months, something happens to the OCT machine, conks off. You don't have OCT machine for the next 6 months. So you have lost a lot of time there. And then you had to rely on somebody else's OCT machine in a neighboring college. And then the quality was not same as what you have. So these become your limitations. All the limitations you list, depending on your study, you might have different forms, kinds of limitations. So the current PG who's working under me, main limitation of his study is all his participants have mild or to moderate NPDR. His study does not include severe diabetic retinopathy at all. So they cannot be generalized. One more study which my PG did was smoking and correlation with optic nerve changes. And the idea was to include both females and males. She could not include many females, hardly 4 or 5 females, smokers she could include. And therefore, that became a limitation of the study, which she listed there and said, this was a big limitation because I was not able to recruit female smokers. And why? Because many of them don't want to say they are smokers. They don't want to give the detailed history because somebody else is there. They hide this history, and therefore it becomes. So anything that has troubled you during your study, list them in the limitations and say, these are the more limitations you are able to identify, the more you've understood your study. Put them all in line. Remember that negative results of your study are as important as the positive study. If your correlation says there is no correlation between the two findings, that was your third objective, there's no correlation, all p-values are not significant at all, don't get disheartened. That also is a significant finding. So give negative findings as clearly as you would give a positive finding, and discuss a positive finding. So negative findings are also important. Please don't ignore them, don't hide them. If your patient had a problem during your study, mention it. This is what the patient had. Some adverse event, mention it. It's important to mention everything that you have seen during your study. Next is writing the references in the right manner. We refer the Vancouver side. I think you also referred, Dr. Sapna was telling just now. It's the same Vancouver style. Easy way of getting a Vancouver style is go to PubMed, find out the article, okay, and go to site, click on site. It will give you almost exact Vancouver style of learning. You could also use reference manager. You could use EndNote. You could use Mendeley. You can use any of the software, but this is one easy way of getting. Just copy it and paste it, and your references are almost right. But in the end, please go through once again, because sometimes not PubMed, but if you have chosen an article from, say, Google Scholar, then you might not get a very good Vancouver style of writing. So make sure all are from PubMed, or you verify that it is in Vancouver style. So list them in an order that they appear in your discussion, right from introduction. If you have use one article in the introduction, that will be reference number 1. And the reference number in the last discussion point number 10 of the discussion point would be the last. So 20, 70, 80, whatever number of references you have. Use this in the Word document. It's very easy to use. There's something called references here. Go to references and insert EndNote. Okay, you put your cursor exactly here. Suppose after systemic associations, you want to put a reference. You click here, go to references, insert EndNote. It will show you the end of the page. Copy that PubMed citation which you had taken and paste it here. Okay. Next, you write one more sentence, and again you want to make a reference here. Put the cursor here, go to reference, insert EndNote, and you get this here. Suppose now you want to add one more reference here in between the two. Okay, they get automatically numbered 2, 3, and they give you numbering here also, and then they will never change. Suppose you add another reference here, the new reference will become 3. Now this third article becomes 4, and this point automatically becomes 4. So it does everything on its own. Please remember, don't use your Word document like a typewriter. Use it like a Word document which has got lots and lots of features. In the end, there are some repeated references. Suppose this reference you have used multiple times. You can go to the bibliography and rearrange them so that the same reference is repeated with the same reference number multiple times. So you will not have any kind of repetition. If you follow this, you will never fail in your references. You will never miss out any reference. You will not make a mistake in your references. This is very important. Don't again leave this to your guide. Guide is not going to sit with references, checking your this is wrong, page number is wrong, your DOI is wrong. No, this is for you to check because it's a very mechanical thing to do. Once you do that, you come to the annexures. One of the important annexures is the EC approval letter. And if you have got extension of your EC approval, amendment of your EC approval, all those become your annexures. Put your data collection form. Remember, in our ethics committee, we give the EC approval letter. It is valid for 1 year. Okay, and this, if you lose it, you have to pay a fine of 5,000 rupees, because we have seen many students losing it and asking for duplicates. So we made a rule in the university, whoever loses it has to pay 5,000 rupees. This is a very important document, just like your visa and other documents which you keep it in a very safe manner. Please keep this EC approval letter, scan and send one copy to your guide so that the guide has one copy. Scan and send one copy to your department so your department knows the details about the EC approval. Make it a habit and you will never lose it. Put the data collection form there, the empty form, the format that you have followed, the PIS and the ICF. I forgot to write the ICF here. All the permissions that you may have taken. For example, you need permission from the MRD to collect some data, or you need to go to the Anganwadis, some community medicine studies. You need DHO's permission, you need somebody's permission. All those permission letters will become part of your annexures. And finally, the master chart, Excel chart, a clearly written Excel chart, cleaned up chart. You know what is cleaning of the Excel chart, right? So don't go on writing years. Somewhere you write months in the age. Suppose age of the child. You write in one row, you write months. In one row, you write years. That Excel is not going to read that. You have to write one common format and write it as years or months and convert that. Only numbers should be there so that your master chart is clean. Okay. And other things that you also need to add to your dissertation work are the, sorry, I'll call later. Okay. The master chart should be completed. All the cases that you have included should be included, including your follow-up. And sometimes it can go to multiple sheets. So you can ask the printer to get you a bigger chart which can be folded upon itself and become a master chart. You can do it in a very attractive manner. Other things that you need to add are list of abbreviations used, a glossary of items, list of tables, list of figures, content, page numbers, and also the acknowledgement. This is the best part of your dissertation. You can thank profusely all the people that you have, those who have helped, including the EC. First time I saw somebody thanking the ethics committee for all the inputs that they have given. It felt nice. And then I asked my PGs that acknowledgement, whatever you have written, make multiple copies of that paper and give it to all those people who you have listed. They'll be very happy with that. So complete it with a good acknowledgement, and that will be end of your components. So a quick this on tips and pearls also. Start early. Don't wait for midterm or end of your 1 year to start the study. Start very early because you know early bird gets the first worm. Follow the timelines. You have stated the timelines that I'm going to start collecting the data immediately after the EC approval. 9 months or 10 months or 1 year, I'm going to collect the data. Follow it. If you have 100 samples to be collected in 10 months, it's very clear that you have to collect 10 samples every month. Make sure that you are doing it. Every end of every month, what is the sample I have to collect? 10. How many I have collected? Only 5. That means I have to buck up. I have to collect more in the next month. So race with yourself, follow the timelines. Regular reviews with your guides. So I forgot to put one more screenshot, which I wanted to say. I make groups with each of my student, WhatsApp group. Every time the student collects one case, he or she puts it on the group so that I know one more participant has been recruited. So it's an ongoing, it's not even 3 monthly or 4 monthly or 5 monthly or 6 monthly review. It is continuous review. So the moment today my PG collects as one participant is included in the study, immediately she puts it, one participant included, and these are the details. So every day, end of the day, I know what is the status of my student study. So only 2 people in the group, in the WhatsApp group. And I've been using it for the last 5 years. It's been a wonderful thing to do. Only dissertation related work is discussed on that group, WhatsApp group. It has really helped me. I think if anybody likes it, can follow it. Part A, start very early. Don't wait for your data collection to be completed to start the Part A. Part A will include all the review of literature, methodology, all that you can start writing right from the beginning, particularly the review. Keep your hard copies safe in a locker somewhere. Your informed consent forms, your PIS, your data collection forms, keep them in a very safe manner so you don't lose them. Think of it, what if you lose around 50 cases that you have collected? Are you willing to do that whole thing again? No, right? You can't take the consent of 50 people once again. The patients have already gone. Don't ever lose a single sheet of your data. Okay, it's very, very important. Ask for a cupboard, ask for a locker, and put it there. Don't share with others also. Soft copy, this is how I deal with my student projects. We make a folder. This is my main folder, ophthalmology research folder, in which I have made a folder for my PG whose name is Deepta dissertation folder. I have made multiple folders here. And this is on the Google Drive, which is shared by the two of us. Okay. So this is all about the synopsis, approvals, the first draft, second draft, third draft, corrections, all the references, all the articles, whichever she's adding up every time, one copy is added here. The permissions, approvals are all in this. The clinical photographs are here because this was a proptosis related study. A lot of photographs were taken. All the photographs are here, and the final dissertation project. We always work on Google Drive so that I don't have to wait for her to write the results and then send it to me. She takes 1 month, then I take 1 month. For 1 month where the data, the document is with me, she can't work because I'm making changes. Time is lost. To work simultaneously, the PG and the guide can work on Google Docs, which is online, it's continuous. So when I'm working, I can see her working also. I can give my comments there and we can work together, including the Excel sheet. As and when she collects the data, she goes on adding here so that when I have time or I'm waiting for the lift also, I sometimes go, okay, what is happening in the Excel sheet? In the WhatsApp group, she has said 5 cases, here only 4 are there. I immediately asked her, why have you not added the 5th case? So it helps in making sure that things are on time. This is the Google Doc I was talking about. Both of us are working. I can see if he's online, I can see that he's online here. Then I make these comments, add range of duration. Some comments I have made to which he has replied, I shall do it, madam. And then once it is done, I respond to it saying this is done. So this is a very interactive and very good way of working together, whether it is a PG or your collaborators when you're doing together studies. This becomes a very useful tool, Google Doc. Only problem is you should be online when you're working. These are the photographs that I was mentioning. For each of the studies, she has made this. Of course, I should not be using the name, so I'm quickly changing the slide there, because all the patient photographs are there in each folder so that I can access it anytime I want to, and I know that she's doing the study in a right manner. Understand the guide. You can understand that a guide is not one person who's having only one student and one dissertation to review. The guide will have multiple. For example, I'm in the ethics committee. I'm in multiple memberships of within the university. I have multiple work. Plus, I have work at home. I have 2 kids to look after. I have a husband to look after. My in-laws to work. No, lots and lots of every guide also has a lot of other things to do than your dissertation. So try to find out what is the right time to contact, what is the right way to contact, and sync with your guide. That's very, very important. And have a healthy race. You all are doing PG dissertations together, your co-PGs. Do it together. Say that, oh, I'm finishing my review of literature. What about you? The PG says, no, I have not started. Do it. Encourage each other. Be together. The race is not to see who is first. Race is to see that everyone reaches the final row. That's what is important. So you can all help each other in completing your dissertation and help. This is the end of my slides, and all the best to all of you. Hope I have not taken too long. Over to you all. Thank you.
Oh, thank you, madam.
Thank you.
It was so useful, not only for the PGs, actually for guides also it was very useful, madam.
Okay.
So useful,
Thank
practical tips, really wonderful.
Thank you. Thank you.
And next, we'll move on to the next topic. I think, madam, we can have the questions later because of the shortage of time. It's okay. Is it okay,
Yeah,
madam?
sure.
So next topic is academic integrity and plagiarism. Recognizing and avoiding plagiarism is essential for maintaining academic honesty and fostering a culture of respect for intellectual property. I hope today's talk will provide us with valuable insights into what constitutes plagiarism and how to avoid it and the consequences of engaging in such practices. Our speaker is Dr. Asma Rahim. Let me just share my screen. Okay. Dr. Asma Rahim is the head of Community Medicine Department. I'm sorry. Okay, Madam has a FAMA Fellowship in Medical Education, and she is an International Fellow in Medical Education, Philadelphia. She has professional diploma in Travel Health, Liverpool School of Tropical Medicine, and she is also author of the undergraduate textbook Principles and Practices of Community Medicine by J.P. Brothers. And we are eagerly waiting for your talk, Madam. Over to you. I'll just stop sharing the screen.
Yeah.
Yes, Madam.
Thank you for that gracious introduction. And moving on from that wonderful presentation by Dr. Uma, so clear and crisp. So thank you for that wonderful presentation. And thank you, Sapna and the IRC family, for this opportunity to present and share what I know about plagiarism. So hello all. So in the next 2 minutes, maybe 20 minutes or so, let's take a look at how to minimize plagiarism while loading your thesis as per the KUHA's requirement or in any other journals for future publication. So what all things we need to be careful about. Now, if you look at plagiarism in India, it's already documented, but it is not so well documented. It's there in the tip of the iceberg. It's almost plagiarism as a fashion across academic streams like medicine, arts, and science in India. The thing is, since we do not look out for it, we fail to detect it often. Actually, many of